I want to go back to the back, though. Let's go back to the spine. Because, I mean, this is such an interesting part of our body, and I don't think a lot of people understand it. You mentioned this earlier in the show, that the spine affects everything. So if I'm having tingling, for example, I've had this occasionally, in my hands, is that related to my spine?
Every nerve in the body exits from the spinal column. So pains in distant parts of the body can definitely be caused by spinal misalignments, pinches at the exit from the nervous system at the spinal column.
What is a pinched nerve? I've heard this term in my entire life.
Yeah, it's kind of a misnomer, but it's...
Good, let's clear it up.
It's what happens when a vertebra is misaligned slightly, which reduces the opening that it has from the spinal column, and that causes some compression on the nerve, and it affects its normal ability to... It's just like a water hose. If your foot on a water hose, you will decrease the amount of water flowing out at the end. The same is true of the spinal system.
Wow. Well, I want to talk a little bit about something brand new that you had talked to me about before we started the program that is now in this country, and body cryotherapy.
Whole body cryotherapy.
What is that?
It's new to most people in this country. In fact, it's fairly new in general. It was developed in 1978 in Japan by a doctor who was looking for a method of reducing the pain before he manipulated and treated his chronic inflammatory disease patients.
Because they're in so much pain already, he didn't want to cause more.
Exactly.
Gotcha.
He wanted to kind of give them a little relief before he began to work on them. And as we spoke about earlier, ice is very good at numbing and producing some anti-inflammatory effects. And so he began working with liquid nitrogen, vaporized, and he called this procedure whole body cryotherapy. And here's how it works.
Okay.
There is a small chamber where a patient is put in for a brief period of time, about 3 minutes. The temperature is lowered in that chamber to minus 270 degrees Fahrenheit.
Oh, my goodness.
That's pretty cold. But
you said only 3 minutes.
Only 3 minutes.
And you're standing in this?
You're standing in this chamber, and the vaporized liquid nitrogen circulates around you for 3 minutes. The nervous system receives a message that is sent to the brain that this is so cold that I need to preserve life mechanisms. And so there's a powerful constrictive force of all the peripheral blood vessels. The blood is shunted to the interior of the body where it's circulated. Endorphins are released. Endorphins are your body's natural pain relievers.
Right.
And there's also a strong anti-inflammatory effect from the contraction of the blood vessels. Now, this goes on for 3 minutes, and this enriched blood in the center of your body and going to all your organs is enriched. And when the procedure is over, you step out of the chamber, and then there is a powerful dilation of your circulatory system, and all that enriched blood rushes back out to your skin.
Wow.
So this cold does not penetrate down to your core, so there is no lowering of your core temperature.
Interesting.
The brain receives a message that this is too cold, I've got to preserve life mechanisms. And so there's a stimulation of all these enzymes from your brain, the hypothalamus, and these enzymes, as well as the endorphins, elevate your survival mechanisms.
Gotcha.
Your basal metabolism is increased. You burn approximately 500 calories after the procedure.
Wow.
That's always interesting.
You saw me grinning at that one.
Yeah. And there's basically a increase in your body's natural immune system as a result of this procedure.
That's good news too.
Yes, there's a whole bunch of good.
Now you have this in your office?
I do.
And now how long have you had this? Because I hadn't heard this.
I've had this for about 2.5 years, and as you might can understand, it's rather hard to explain this to people.
Yeah, but I'm understanding it now, and our audiences on our radio stations are now going, wait a minute, didn't know this existed, or maybe they did know, and maybe they're one of your patients, but now this is available in your office, and should someone need this type treatment, it's available here in Tallahassee.
Yes, it is.
Wow. What kind of results have you seen from it? I'm curious. I mean, give me an example of a patient that, you have felt like, oh, wow, if it weren't for this, I don't know how they would be dealing with daily life.
We have a great deal of good experience in cryotherapy. A lot of, it's most popular amongst athletes.
Okay. And we've got our colleges here and our national championship team. So
exactly. In fact, that's where it's been most quickly received because of the competitive nature of athletics these days. They're all looking for anything that'll give them an edge.
And this is a natural edge.
And this is a natural edge. It replaces the old ice bath, which was a...
Oh, I remember those things.
They're just a very
you see them in the movies, and the guys are... yeah.
Yeah, and they lower your body temperature and your core temperature. They don't make you feel very good, but they do reduce inflammation. Now, this can be achieved in 3 minutes with this cryotherapy. And so Olympic athletes have adopted it. The Atlanta Hawks, Atlanta Falcons, they use it.
Wow.
My daughter has a salon in Atlanta where she goes out and administers these to the football camp, which she's doing right now. And they love it because instead of 20 minutes in an ice bath, they have 3 minutes in here, and they're feeling